Thank you for tuning in. You're listening to the Beyond 50 radio program. I'm your host, Daniel Davis. Joining us here on the Beyond 50 radio program today is author of a new book, The Great American Heart Hoax. Just imagine that more than $60 billion a year is spent on high-risk, expensive, and invasive procedures that neither save lives or prevent heart attacks. So why do we do it? Because the doctor suggests so? Well, let's just explore this particular program and see what's going on here today. I'd like to welcome on the program our guest, Dr. Michael Osner, to the Beyond 50 radio program to talk about the Great American Heart Hoax. And Dr. Michael Osner, thank you for joining us here on the Beyond 50 radio program today.
Thank you very much.
I really enjoy your title, The Great American Heart Hoax. That's quite a title. Tell us what's going on here.
Well, it is a hoax, and the hoax that we have is that for millions of stable individuals in this country who happen to have a blockage in their coronary artery, we're subjecting these men and women to stents and bypass surgery on a regular basis, and there's no data to support putting in a stent or doing bypass surgery in patients who are stable. And there's clearly no evidence that it lowers the risk of a future heart attack or prolongs their life. Now, contrast this with people that are unstable, people in the throes of a heart attack, people that have significant chest pain despite maximum medical therapy. Those individuals clearly benefit from intervention, whether it be stents or bypass surgery. But where I think we have gone astray is by doing all these procedures in stable individuals where we don't have the data to support it.
Now, when you talk about stable people, who are we talking about here specifically?
Well, certainly when we use the word stable, we're talking about patients who are in the doctor's office, who have had a stress test because of some chest discomfort or because of an abnormal EKG or any number of things, and they're not in the throes of a heart attack, they're not having continuing ongoing chest pain, and their doctor says, look, we've run the test, we've determined that you have a blockage in one of your arteries, and they're having an ongoing discussion with the patient. That's a stable patient. Versus the patient in the emergency room who is either in the midst of a heart attack or they have severe chest pain and are about to have a heart attack. That's a different situation.
Now, it seems to me when you think about heart surgery, opening up your chest, it seems to be tremendously invasive. And I think to myself, does it really, in the long term, really help somebody?
Well, you know, we in medicine, we basically go by clinical trial evidence. It's what we call evidence-based medicine to make recommendations. And if you look at the three major heart surgical trials performed many years ago, they were the VA study, the coronary artery surgery study, or the CAS trial, and then the European CAS or EuroCAS trial. All three of these major studies failed to show any improvement after heart surgery over conservative medical management of patients. In other words, that the surgery did not prolong life and it did not prevent future heart attacks. The stent trials and the angioplasty trials with balloon angioplasty also failed to show a incremental benefit. These were the AVERT trial, certainly the COURAGE trial that was recently reported. These trials, again, failed to show in stable patients a prolongation of life after these procedures or a reduction in future heart attacks. Now, again, we have to ask ourselves the question. We're spending billions and billions of dollars on these interventional techniques. And if the billions of dollars translated into improved outcome, namely people are living longer, it's preventing heart attacks, one could argue it'd be worth it, but it doesn't. And as a result, we have an alternative. We have an alternative which is a lifestyle intervention approach utilizing nutrition, utilizing exercise, utilizing stress management, inflammation, reducing oxidative stress, all of the things that I talk about in part 2 of my book, a 10-point plan that I've utilized to keep people out of the hospital and out of the cath lab and out of the operating room. That works. We have mounds of evidence that shows that this type of an aggressive prevention approach significantly lowers the risk of a future heart attack, and it also prolongs life. This has been well chronicled and well reported in the literature, so that we know that a prevention approach utilizing lifestyle intervention and medications can help to not only halt the progression of the disease, but send it in the other direction.
Mm-hmm. Now, Dr. Osner, when you take a look at common medical practice and you see a patient who goes in, and let's just say for a moment that they have been diagnosed with heart disease, and then it's recommended to have surgery, it's really difficult, it seems, for a patient to know what the right thing to do is, because generally we take our doctor's word as the gospel. What would you say to people who would be listening to this show who might know somebody in that situation, that they might be able to suggest, well, there is an alternative, and how to go about doing that?
Well, I think, Daniel, that really what has to happen is that we really need to provide proper informed consent to patients. Mm-hmm. And and let me paint the 2 scenarios. If you were a patient and your doctor walked into your room and said, you have a blockage in your artery, you are a walking time bomb, and we're going to fix you in the morning, either with a stent or a bypass operation, and he walked out of the room, you would be, number one, you'd be very nervous. Gee, who wants to be a walking time bomb? And number 2, wow, he's going to fix me. Mm-hmm. Now, contrast that with the doctor walking into your room and saying, you've got a blockage in your artery, and there are 2 approaches. We could take an interventional approach. We could do bypass surgery, which is major surgery, and it has significant risks associated with it, including heart attack and death and stroke while we do the procedure. It's going to cost thousands of dollars. Or we could put in a stent, and the stent is going to also have potential risk. It's going to require, in the case of coated stents, that you take blood thinners for the rest of your life. And by the way, these procedures aren't going to prolong your life by 1 day, and they're not going to prevent a future heart attack. But by the way, we have a third alternative for you besides surgery and stents. And that third alternative is to put you on a delicious diet. I've recommended the Mediterranean-style diet for years because of all the evidence. We're going to get you into a good exercise program involving walking. We're going to have some simple stress management techniques. We're going to teach you all of the tricks of the trade, how flossing your teeth lowers inflammation, how all of the types of blood tests that you can get to follow to decrease your risk of further buildup of plaque. And this technique is going to significantly reduce your risk of a future heart attack and lower your risk of death. Which one would you choose? I don't think there'd be any question that given that type of informed consent, people would say, well, gee, I'd like to go the route that gives me the benefit of reducing my risk of a future heart attack, lowering my risk of death, as well as not being invasive, not cracking my chest open, not doing all of those things that involve invasive treatment. So clearly what we need to do is provide informed consent. I would be the first one to say that I have the highest respect for heart surgeons and interventional cardiologists. And there are settings where that would be the first thing we recommend. As I said, the unstable patient clearly benefits from surgery and intervention. And I think that, we're not talking about unstable patients, and we're not talking about very uncommon scenarios such as left main disease and But for the lion's share of Americans out there who are stable, who have blockages, who are being sent down that slippery slope to more and more unnecessary intervention, there is a better approach. And it's the approach that I've chronicled in my book, The Great American Heart Hoax. And I think that we really need to start practicing evidence-based medicine and do really for the patient what's going to give them the biggest bang for the buck. Treatment that is going to be more efficacious, clearly with significantly less risk, and certainly less expensive.
Mm-hmm. It's interesting, Dr. Osner, because I think it was about 8 months ago I was talking with a doctor out of California, and he was giving me what the definition of malpractice is, and we seem to be in this litigious society where it gets to the point where doctors are starting to step away and say, we're not so sure we even want to practice anymore, just for the case of people who want to sue for malpractice. And his definition for malpractice, at least according to the state of California, was stepping outside the procedures that are prescribed by law. And this would also include prescribing drugs, for instance. And so if something goes awry, a patient could actually sue a doctor for doing something that was actually against the doctor's better judgment, that was actually better for the patient. Now, that even would up to and include, nutritional and dietary changes as far as the patient goes. Now, I'm starting to see, and through this program here over the last 5 years, more and more doctors are starting to step up and say, look, there are better ways than the ways we've been doing things that are better for the patient. They may not necessarily be better for pharmaceutical companies. And in this particular case here, you're saying that in heart surgery, 70 to 90% of the time, people don't need heart surgery. How is it that this profession is becoming, let's say, the stewards of a brave new world, so to speak?
Well, you bring up some interesting points in the area of medical legal issues. Clearly, one of the driving forces behind intervention for many years is the fear of doctors that, gee, if I don't send my patient off to the surgeon or the interventional cardiologist, who has a blockage, to get him treated with a bypass operation or a stent, and that patient should, suddenly drop dead for whatever reason, I could potentially be sued for not doing something aggressive. And that was the mentality, gee, I better send the patient off for that reason. And, clearly that didn't make sense because, what about the patient who's sent for intervention and then never makes it off the table or has a major complication on a procedure that really shouldn't have been done in the first place because there are better alternatives? I think that at the end of the day, in the practice of medicine, what doctors are charged with is exercising good clinical judgment. Mm-hmm. And at the end of the day, I also feel that having a good rapport with your patients, sitting down, discussing really all the alternatives and say, listen, here's what we can do, here's what we can't do, here are alternatives, and having the patient educated. Because one of the things I think we have forgotten in medicine is the meaning of the word doctor. Mm-hmm. And it's amazing how many doctors don't know what the word doctor means. It means teacher. And really what we should be doing in medicine is teaching our patients how to stay healthy. And, clearly we have gotten away from that with all of our fancy technology, from 64-slice CT scanners to the latest and greatest of MRI machines to very technical surgery. And all of these modalities are wonderful. They're great to have for the patient who slips through the cracks in the emergency room. We need to make a quick diagnosis. I'm glad we have all these CAT scanners. I'm glad we have cardiac surgeons and interventional cardiologists. But again, I go back to the lion's share of patients are not in the emergency room. They're in the doctor's office. And I dare say that what we really should be doing is calling time out and going back to what really works, sitting down with patients, clearly being able to explain to patients what was really going to help them stay out of the hospital. And, I could spend an hour on your show just talking about nutrition, because what we have done in this country is people are consuming the very highly processed and toxic American diet, laced with trans fats and high fructose corn syrup and sodium, saturated fat. That's like putting diesel fuel in a gasoline-powered car and expecting it to work. It's not going to work. And then when the car breaks down, doing expensive work to get it fixed. That's what we're doing in this country, and it's wrong. We should be spending more time. Now, part of the problem, I will also say, is that we are not rewarding doctors for practicing prevention. Because clearly, in my opinion, if we took just a fraction of the money we're spending on intervention and we poured it into prevention and allowed doctors who literally are forced to see 50 and 60 patients a day, spending 5 minutes a patient just to make ends meet, that's not right. We really need to pay these doctors a little more to be able to sit down and counsel their patients on how to stay healthy, because it does work. And I tell you, the most satisfied patients in the world in my practice are patients who were told that they needed to have bypass surgery or a stent, and they're frightened. And in some cases it was necessary, but in the majority of these stable individuals it wasn't. And to see these people 10 years, 20 years later, and they're still healthy as can be, and they're happy, and they're leading the kind of lifestyle that is a heart-healthy lifestyle, which can prevent and reverse this disease that we call atherosclerosis, which at the end of the day, we missed the boat, because this disease is not a progressive buildup of sludge in our arteries. It's a chronic inflammatory disease, and it's inflammation that drives this disease and leads to plaque rupture. And the majority of plaques that suddenly rupture and kill men and women or lead to heart attacks are not the 90% blockage that everybody fears. It's the 10% blockage, that nobody has symptoms with a 10% blockage until that blockage, which is like a pimple in the artery wall, that's what we call plaques, suddenly ruptures. And when it ruptures, the artery clots off. You develop a clot. So you could go from a 10% occlusion to 100% occlusion in a matter of seconds after it ruptures and clots off. And that's why the majority of people who develop heart attacks or who drop dead suddenly have no prior warning. Look at the reporter Tim Russert. There's a perfect example of that. What we understand, simply by putting Band-Aids on the problem, by trying to put in stents on the 90% blockage that may not be the culprit lesion anyway, has never made sense to me. Because really the majority of plaques that are going to rupture and lead to a problem, as I mentioned, are the small plaques. And as a result, medical therapy, a prevention approach, treats all plaques, large and small, all up and down the artery. Whereas surgery or stents only focus on a specific tiny little area and has never been shown, as I mentioned, in stable individuals to reduce the risk of future heart attack or prolonged life.
Now, it's really fascinating that you bring up the point that when it comes to preventative medicine, the United States seems to be lagging poorly behind. And over the the 5 years that we've been doing our program, we keep hearing about how in Europe they do this and they do that. And you think to yourself, that just makes so much common sense. What's going on here that they're kind of blocking us from doing what seems to be the right common thing to do?
Well, unfortunately, what has happened with the entire intervention industry, if you will, is that every hospital on every street corner in America figured out that for economic survival, they had to build cath labs, open heart facilities. Everybody's doing open heart surgery. And every one of these hospitals recognizes that that's the major cash cow of any hospital, is their cardiovascular services. And remember, another thing is that in order to keep your ticket, you have to do so many procedures.
Right.
And what we have now is a feeding frenzy of all the hospitals, and they all want to be the one doing the most procedures. You know, we really need to call time out. We really need to say what really works. And, you know, again, it's not that I'm against heart surgery. You know, certainly we should have specialized centers to do heart surgery and to do intervention. But to say that we need to be doing the volume of intervention, and it's forecast that we're going to be putting in over 1 million stents this year and doing 500,000 bypass operations. Remember, there are countries that do a fraction of the intervention that we do, and yet they're healthier than we are. They have fewer heart attacks. So clearly all of this intervention is not translating into better health. And, I feel that for us going forward in this country, we really have to start focusing on those technologies that are going to really give us the bang for the buck, if you will. And it really, when you think about it, a lot of it is lifestyle intervention. We talked about nutrition. We talked about exercise, getting 30 to 45 minutes of walking a day. If people only realized how that translated into better health and a longer life, that was shown in the Framingham trial. Mm-hmm. You don't need to run in the Boston Marathon. You don't need to be jogging down the street. We need to get Americans moving. We have a major obesity epidemic in this country. And that obesity epidemic extends to children and adolescents and young adults. 2 out of 3 Americans are either overweight or obese. That's tragic because that's going to lead to not only high blood pressure, it's going to lead to type 2 diabetes. And what's the problem with that is type 2 diabetes leads to heart attacks, leads to strokes. We need to do what works. We need to get people moving. We need to get people eating healthy. We need to start focusing on stress management. And, everybody likes to think of a green, purple, and yellow pill as the answer. We know for years, going back to some of the original research by Dr. Herb Benson at the Mind Body Institute in Boston, that simple techniques like the relaxation response and breathing techniques can significantly lower blood pressure, can significantly reduce the amount of adrenaline that's floating around in our body. That really is not appreciated. We're not really doing and emphasizing the importance of stress for cardiovascular risk reduction, as well as not focusing on trying to reduce the amount of inflammation in our body. I said earlier that inflammation is what drives this entire process. Mm-hmm. And, people ask me all the time, well, where does this inflammation come from? Well, we know that one of the major sources of inflammation are the food that we eat. This highly processed food ratchets up inflammation, and it leads to all of the inflammatory proteins that in our body contribute to the increased risk of heart attack and stroke, as well as, I may say, cancer. We also know that obesity, people think of obesity, especially abdominal obesity, as a cosmetic problem. I don't. I look at this.
Isn't that amazing?
Yeah, I look at this as the abdominal fat is an actual endocrine organ. These fat cells are pumping out inflammatory proteins, contributing to heart disease, contributing to cancer, contributing to high blood pressure. We also know that certainly there are a lot of other things that contribute to chronic inflammation, such as poor dental hygiene. Now, I can tell you that I've never had a patient walk into my office and tell me that they don't brush their teeth at least once a day. But I could tell you that most people don't floss. And flossing on a regular basis lowers inflammation. We know that seeing your dentist, seeing your hygienist, getting proper dental treatment helps to avoid periodontal disease. And periodontal disease leads to a state of chronic low-grade inflammation, which ratchets up our risk of heart attack, of stroke, and a whole number of disease states. So that's just one example of how inflammation can be treated and reversed simply by changing your diet, getting a little exercise, trimming down, taking good care of your teeth, flossing on a regular basis. There are many other ways, as well as reducing oxidative stress. And one of the ways of doing that, by the way, is avoiding excessive radiation. And I have a chapter in my book called The Radiation Ruse, because we are subjecting Americans to far too many CAT scans, these CT scans, which deliver a tremendous amount of radiation to the body, and that increases inflammation, it increases oxidative stress, and I dare say it increases a person's risk of cancer. And, again, in the unstable patient, these CAT scans are sometimes needed. But now what we're seeing across America are all these advertisements to come in and for people that are perfectly healthy, no symptoms whatsoever, to come in and get these screening CAT scans. In fact, some of them are whole body scans that will tell you if you have a cancer or have a heart disease. Well, that's ridiculous. And I
Pretty
think
soon
that,
we'll be putting quarters in them at malls.
Yeah, in fact, fortunately, this is, I've got good company in opposing this, the American Heart Association, the American College of Cardiology, and the American Radiology Society. Clearly this is wrong. We should not be bombarding people with radiation exposure indiscriminately and without indication. We know that some of these CAT scans are the equivalent of getting several hundred consecutive chest X-rays. It's significant radiation, and that is another thing that people need to know, along with the idea that when you go for your annual physical or annual checkup, you really need to get the proper blood work. Most people don't know what that is. And, there are certain blood tests, such as measuring inflammatory risk, measuring the number of bad particles in your bloodstream. I talk about this. In fact, I've got on my website, which is drosner.com, that's drozner.com, I've got a bunch of freebies. And some of the freebies are what blood tests you need, or you should ask for when you go for blood tests. And, this is the way to reduce your risk of a heart attack, making sure your numbers are at goal. And this is very inexpensive to do this. And to me, this is what we should be doing. We should be getting with the guidelines. We should know that our blood pressure is controlled, our blood cholesterol is controlled, our blood sugar is controlled, our inflammation is controlled. All of these things are important. That's the easy way of controlling cardiovascular disease. It's the way that costs the least amount of money. It certainly doesn't involve any intervention with all the risk. But to me, that's where we are going to get the most benefit in this country.
Fascinating book, again, The Great American Heart Hoax, and our guest joining us today, Dr. Michael Osner. Out there, too, there are so many confusing messages about what the right thing to do is, especially if it comes to diet. Pretty soon vitamin E is a good thing, and then all of a sudden it isn't such a good thing, or it's a specific type of vitamin E. And, certainly if I was to come to you and say shark, there would be a reaction. And it seems that cholesterol has that same reaction among people. So what's the scope here on cholesterol and its relation to the potential for heart disease?
Well, I'll answer that, but first, I definitely want to answer the one on vitamins first, because when I say vitamins, most people are thinking about pills. However, when somebody says vitamins, I think about food.
Right.
And make no mistake, there is no controversy about this. Eating a wide range of different color fruits and vegetables is your best way of providing literally thousands upon thousands of vitamins and antioxidants that help to keep us healthy and fight off these free radicals. It really is not teasing out one vitamin, putting it into a pill, and giving it to a person who doesn't have a vitamin deficiency. That, to me, is not the correct approach. So let's clear that up. As far as cholesterol is concerned, also there's a lot of confusion because, and I try to, in my book, I talk about, the different types of cholesterol, because cholesterol is not really the problem per se. It's with the vehicle that packages cholesterol. Cholesterol doesn't travel in the blood by itself. Now, cholesterol is very important, and if it's packaged into what we call LDL cholesterol, low-density lipoprotein. This is like, I liken these lipoproteins to little automobiles that carry passengers. The passengers are the cholesterol. So, since cholesterol can't travel in the bloodstream by itself, it needs to get into the automobile to be transported around the body. And cholesterol serves a worthwhile purpose in the sense that it's important to have for cell membrane function and other things, steroid function. But what happens when we have too many of these automobiles carrying cholesterol, it pours into the blood vessel wall, and then when these little vehicles that we call LDL cholesterol, which the lipoprotein carrying cholesterol gets oxidized, then it starts the whole atherosclerotic disease process, because then inflammatory cells come into the picture. They gobble up these oxidized cholesterol particles, and that kicks off the whole ball game, leading eventually to plaque rupture, to heart attacks, and to strokes. So is cholesterol important? Absolutely. However, is the mechanism just cholesterol going around the body? No. It's much more complicated than that, because what we know is that if you lower your cholesterol significantly, it really slams the door shut of developing atherosclerosis, with certain exceptions, involving certain hereditary forms of dyslipidemia, cholesterol problems. But we know that from the populations on this planet, what we call hunter-gatherers, people that walk around with cholesterol levels of, say, 130, 140, it's very rare that they develop heart attacks. So we know a low cholesterol is very important. However, a cholesterol level doesn't necessarily have to be very high for you to have a heart attack. So we now have guidelines, and, we know that a total cholesterol, if you want to have the, what's your ideal cholesterol, you should try to strive for keeping your total cholesterol below 150, keeping your LDL, remember that's the bad cholesterol, below 70, keeping your good cholesterol, we call it good cholesterol because, again, just like the little automobiles, these are the good automobiles that go picking up passengers from the artery wall, picking up the cholesterol from the artery wall and taking it away. So we like to see a high HDL, or high-density lipoprotein. That's the good cholesterol, and we like to see those numbers in men at the very minimum above 40 and in women above 50. So we do know a lot about cholesterol. Cholesterol is important, but it's more than what people think, that it's just cholesterol that causes the problem. No, it's the whole package of cholesterol, inflammation, all of the other factors that I talk about in the book that helps to explain the cholesterol riddle.
Now, earlier in the program, you mentioned the Mediterranean diet. Now, what is it about this diet that I guess it sounds like it supports really good heart health?
Well, first and foremost, one of the things that, one of the comments that I'll make is that every single day there's a different diet that comes out.
Isn't that
over
true?
The years, I've seen it all. I've seen the grapefruit diet, the rice diet, you name it. There was once the hot fudge sundae diet. You name it, I've seen it. The problem is, any time these diets come along, I ask the simple question, where is the data? Where are the clinical trials that show that this diet will reduce your risk of heart disease, will lower your risk of diabetes, of high blood pressure, of cancer, of all these diseases? Now, if it doesn't have any data to support that, in my opinion, you shouldn't follow that diet. And one of the things about the Mediterranean diet, and I could tell you if you turn the clock back 20 years, I didn't know the first thing about nutrition. In fact, in medical school, we never had a course in nutrition. And one day I come home after doing these procedures, these balloon angioplasties. I had patients in the emergency room, and I flop down about midnight while my wife is making dinner, and I pick up a journal. And lo and behold, there was a study called the 7-Country Study by Dr. Ansel Keys. Years ago, they did this study and showed that by following a Mediterranean-style diet, which is fresh fruits and vegetables and whole grains and cold water fish and all of the things that were done in the Mediterranean regions of the world, and really it all translated into non-processed foods, they had a 80 to 90% reduction in their risk of developing a heart attack or dying from a heart attack prematurely compared to their American counterparts. And when I saw that, I called my wife over, my wife's a nurse, and I said, you got to stop what you're doing because this is unbelievable. This doctor is getting better results with a knife and a fork and a pair of walking shoes than I am with all my catheters. And believe me, I haven't looked back since that time.
And tennis shoes are easier than catheters.
That was an epiphany for me.
Yeah. That's amazing. Now, it's kind of interesting because, every night whenever somebody turns on a television, you always tend to see the commercials that present a problem, and then they present a solution through a pill. And more you're starting to see an upcropping of the kind of pill that might prevent heart disease, and then there's a whole slew of symptoms. What do you say about that? How would you advise people, I guess, to ask themselves the right questions in the face of something like that so that they can make the right decisions? Because generally, they may see that, they may go to their doctor, say, what do you think about this? And either it's going to be supported or it's not, and so you find that you become, I guess, a victim of your own choice, so to speak.
Well, I have a chapter in the book entitled The Pharmaceutical Follies. I talk about these issues, and, medications are both good and bad. Clearly medications and the pharmaceutical industry has done a tremendous amount of good. After all, were it not for penicillin, we would have seen, penicillin saved countless number of lives. Statin medications that we use to lower cholesterol, we know that these medications are very effective in not only lowering cholesterol, but actually lowering inflammation that I've been talking about. The problem is this. Now we have, years ago, there was no advertising on television. Now we're bombarded with all these advertisements. And I'll tell you, my critique of this is that we are made to think that every problem that's out there, there's a pill for a solution. And that we need to take medications and this is going to solve the heart attack riddle as well. It won't. We know that medicines should never be taken in place of lifestyle intervention. Lifestyle changes are the most important things we can do. Diet, nutrition, exercise, smoking cessation. Medications should be taken in addition to lifestyle changes if needed, not in place of them.
Right.
And I have had countless patients over the years who said to me, gee, I ate lunch at one of the fast food chains. I had a burger and those delicious French fries, but I'm protected because I'm taking, the statin pill. Right. And I said, no, it doesn't work that way. Basically people think that they can abuse their lifestyle because they're taking these medications. We know, and there's been many studies looking at this, that you get about an 80% reduction in your risk of heart attack by following a healthy diet and lifestyle. You reduce your risk if you're only doing medications by about 30% with the statins and these type of medications. So clearly, the biggest bang for the buck again is, number one, lifestyle changes, and then if your numbers aren't at goal or you are significantly increased risk for a heart attack, that's when these medications should be recommended.
Now, here's another area also to explore as well, and this is generally one that people base their decisions. I think doctors are also would be in this class as well when it comes to medical insurance. Now, there was a time where a naturopath or a chiropractor wouldn't even be considered to be part of the insurance loop. So if you have an insurance program, a medical insurance program that is, if you were to go to these people, they wouldn't be part of the program. They just had to be a mainstream doctor. But you're beginning to see more and more now in the insurance industry that they're starting to accept more of the preventative way of doing things because they realize, hey, this saves us a lot of money. So what do you see in your direct experience, especially if it comes to something like talking about heart disease, how insurance companies are reacting to this, I guess, in favor of the medical community and ways of trying to, I guess, get on board to do the right thing?
Well, we have an insurance crisis in America. We have a healthcare crisis in America. There are literally millions upon millions of Americans that are walking around without insurance because they can't afford it. And I think that really what we are now starting to see, the pendulum swing to the direction of let's not be doing all of these very expensive procedures unless they can be shown and proven to prolong life, prevent heart attack, prevent other disease states. In other words, it's the old show me the evidence. And
right.
The insurance companies are asking that question, and they should be, because I don't think for a minute that we should be, whether it's Medicare or whether it's Blue Cross Blue Shield or any insurance company, we shouldn't be pouring literally billions of dollars into procedures that that cannot be supported by clinical evidence to say that doing all of these fancy diagnostic tests and these procedures are going to allow the patient to live better, to live healthier, to live longer. And I think that now we're going to see a complete restructuring of the entire insurance industry to start really analyzing these questions of how can we make the system better? How could we? And I don't think there's any question that turning our cannons towards prevention is going to be the approach. Prevention is not going to solve every riddle. There is always going to be people that are going to slip through the cracks. They're going to, rupture this plaque and come in with a heart attack. And we'll always need to have interventional cardiologists and heart surgeons. And my gosh, I could spend an hour talking about just the miraculous things that heart surgeons do on a daily basis. Of taking children with congenital heart defects, and a lot of these children are alive as adults today because of the wonderful work of cardiac surgeons. However, as I said earlier, we cannot extend in the area of coronary artery disease the acute unstable patient into the stable population of every Tom, Dick, and Harry or Mary, Jane, and Susan who happens to have a blockage in their artery and have this entire industry of heart surgery for everybody or stents for everybody. I think we have to use good clinical judgment. And at the end of the day, I think that really is our most effective weapon as physicians, as healthcare providers, is good judgment. And the really good judgment boils down to what would you do if that were your own mother or father or brother or sister sitting there on the table? Would you recommend heart surgery, or would you say, hey, we've got a better approach, an approach that does not involve splitting the chest or putting in stents or doing these things. We can always reserve intervention if the patient truly falls through the cracks and absolutely needs it. But certainly, I dare say that most physicians, if it were themselves or their loved ones, would also use the clinical judgment to say, let's go the approach that has been shown to have the most benefit with the least risk.
Mm-hmm. It's interesting. You could just see a conversation now between an insurance adjuster and a doctor. So you're recommending heart surgery on your patient here? Yes, I am. Well, do you realize that maybe 3 in 10 heart surgeries are necessary according to clinical, results? No, I wasn't aware of that. And did you know that 9 out of 10 times that if you just go this direction with your patient, that it's shown to have a significant improvement? Could you imagine just conversations like that beginning to happen? What then would change in the medical community?
Well, listen, I think that we certainly should be having these conversations because honestly, I believe that we have a different paradigm today. We have a better understanding of what causes heart attacks.
Mm-hmm.
The old plumbing theory, which was in place for literally decades, which basically stated that your arteries were like your pipes at home. They just progressively, had a progressive buildup of sludge until you needed to call the guy in the Roto-Rooter truck, and he would come out with his snakes and ram it down your pipes and unclog your pipes. Well, instead of snakes, we now have catheters and scalpels. And, that paradigm has changed because we realize that, our arteries are not plumbing pipes. They're not PVC pipes, and they're far more dynamic than that. And it involves inflammation, and it's not just rigid tubes, and also has the capacity for reversal and improvement. And what we understand is that it's not the quantity of plaque; it's the quality, meaning that it's the highly inflamed blockage, like I mentioned, it's like a pimple in the artery wall. Those are the ones that will kill you. And I've often asked my colleagues, what would you rather have? A very highly inflamed 5% blockage or a very stable 90% blockage? Give me the very stable 90% blockage because it's that highly inflamed 5% blockage that's going to rupture. And when the fibrous cap ruptures, blood will come rushing into that little 5% plaque and will develop a sudden and often catastrophic thrombosis or clot that will lead to sudden cardiac death or heart attacks.
I'll tell you, it's fascinating, and again, I applaud doctors like you who have the courage to step up and say, the conventional way that we've been doing things is just not getting the results that other alternatives are. And to me, I think it takes a lot of courage for doctors in the medical community to rise, as we've been seeing even through the course of this show, to say, look, the old way of doing things is just not effective. It's not good for us. It's not good for the patients. It's not good for anybody. And it's time that somebody starts stepping up and stepping out of the old school guard and talking about it. And for that, I'd like to applaud you for having the courage to do so.
Well, thank you very much.
You bet. Again, the book is The Great American Heart Hoax, and I'd like to thank our guest today, Dr. Michael Osner, for joining us here on the program. Again, thank you so much. Go ahead and give your website out again for people. Sure.
It's www.drosner.com, and that's DROZNER. I have a free newsletter that you could sign up for, as well as many different articles that you could download and videos you can watch. So it's a informative and instructive website. Well, very good. Well, thank you again for joining us here on the Beyond 50 radio program. Thank you for having me on your show. You bet. Take care. And there it is, folks. Sometimes if your doctor points you in one direction, it's still up to you to decide what direction to take. After all, you're the one that has to live with your health.
We want to thank you for joining us here. You've been listening to the Beyond 50 radio program. Also, be sure to visit us at our website at beyond50radio.com. That's the number 50, and sign up for our free weekly e-newsletter. I'm Daniel Davis. Thank you for tuning in. Remember, live your day past halfway.